We welcome you to our module Cirrhosis of Liver, HCC 28 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of cirrhosis of liver. At the end of this module, the learner will be able to explain cirrhosis of liver and alcoholic liver disease in brief, discuss the criteria for the documentation of cirrhosis of liver, identify the ICD-10 codes that fall under the disease, review the example of the assessment and plan for cirrhosis of liver. Cirrhosis of the liver is characterized by the replacement of normal liver tissue by scar tissue, commonly caused by alcohol, hepatitis B, hepatitis C, and non-alcoholic fatty liver disease. There are many ways by which the liver can be damaged. It could be due to a disease, excessive alcohol consumption, or any other cause. After the damage, the liver tries to repair itself, and in the process scar tissues are formed. The scar tissues block the blood flow through the liver and slows its ability to process nutrients, hormones, drugs and natural toxins, and reduces the liver's production of protein. Formation of scar tissues gradually increases as the cirrhosis progresses, eventually keeping the liver from working properly. The most common causes include morbid obesity, diabetes mellitus, high blood fats, hepatitis B and C, and non-alcoholic fatty liver. Other, less common causes include autoimmune hepatitis, primary biliary cirrhosis, hemochromatosis, certain medications, and gallstones. People suffering from cirrhosis do not manifest any symptoms initially, but as the disease progresses, loss of appetite, weight loss, bruises, jaundice, itchy skin, and blood and stool might occur. There is another condition called alcoholic liver disease, which is a form of cirrhosis and overlapping between alcoholic liver disease and cirrhosis, and the documentation is often a possibility. It is caused by alcohol damaging the liver, leading to a buildup of fats, inflammation, and scarring. The spectrum of ALD can include simple hepatic steatosis, acute alcoholic hepatitis, and alcoholic cirrhosis. According to the CDC, in the year 2014, the number of deaths from ALD in the United States was 19,388, and in 2015, nearly 20% of all liver transplants occurred as a result of alcoholic liver damage. The criteria for the diagnosis of cirrhosis and alcoholic liver disease involves abnormal liver function tests, abnormal liver enzyme levels, and hematological testing, or abnormal metabolic findings. Tests such as MRI, CT scan, ultrasound, and liver biopsy may be used to further support the diagnosis. Let us look at the various ICD-10 codes that fall under the purview of cirrhosis and alcoholic liver disease. For alcoholic cirrhosis of liver without ascites, the code is K70.30 and the HCC is 28. For alcoholic cirrhosis of liver with ascites, the code is K70.31, the HCC being 28. For alcoholic hepatic failure without coma, the ICD code is K70.40, HCC 28. For unspecified alcoholic liver disease, the code is K70.9, the HCC being 28. For unspecified cirrhosis of liver, the code is K74.60, HCC 28. And lastly, for other cirrhosis of liver, the ICD code is K74.69, HCC 28. Note that all the diagnoses and causal relationships must be established in order for the coder to abstract properly. The cause mentioned should be specific, and all factors must be linked. For alcoholic fatty liver, for example, the doctor must identify whether the patient is also diagnosed with alcohol dependence, abuse, or use. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of the progress note. Patient name: John Simmons. Date of service: November 13, 2018. Date of birth: September 14, 1979. Assessment and plan: cirrhosis of liver. Advised patient: no ethyl alcohol, healthy diet. Not a candidate for liver transplant. Comfort and support measures in place. Return to clinic monthly to manage symptoms. We have reached the end of our short refresher course on cirrhosis and alcoholic liver disease. We gave you a short introduction to the diseases, reviewed the criteria for the documentation of the diseases, identified the specific codes and HCC category pertaining to them, and finally discussed the assessment and plan for the diagnosis of ALD and cirrhosis. Thank you for joining us.